I just helped a fellow physical therapist eliminate knee pain that had been limiting his deep squats and running without surgery, injections, or shutting down his training completely. In this video, I'm going to walk you through exactly how we did it, why this knee pain stuck around for 6 months, and how you can apply the same principles to get out of pain without resting for months or going down the surgery route. And if you want the exact framework I use to assess and fix stubborn knee pain, I'm sharing it inside my free community. Click the link in the description to join. Uh, Mark, thanks for taking time out of your day to hop on this call with me.
Sure, glad to do it.
Yeah. So I know we're working together with your knee, and just so people know, how did we meet and what were you struggling with before, we started working together?
Well, we met because we're both physical therapists. We both went to Columbia Physical Therapy School. So I've known you for a while because of that. And what was I struggling with? I was having some knee problems.
Oh, yeah. Tell me, what was the knee problems like, interfering with, like, was it stopping you with?
Well, I'm a, I won't let go of like deep squatting and running. Even as I get older, I still believe in doing that and staying active. And um, I I like to front squat pretty deep and back squat pretty deep and jog. And I had right knee pain with squatting very deep. And my left felt great, no problem. I never really had right knee pain before, and it kind of came out of nowhere. Um, and I tried to solve it myself. And when I couldn't, I reached out to you.
Yeah. And we're talking about barbell squats, right?
Yeah, I do yeah, barbell back squat. And I do and I'm proud of this. I can do a full grip front squat so I can get the bar across all my fingers and yeah, I go deep. I used to Olympic weightlift in high
Mm.
school and college and a little not very competitively, but I would still do it. And so I just got addicted to squatting then and I still do it.
Yeah. And how long did you deal with the knee pain before you decided to like get some help with it? How long has it been a problem for you?
God. I think I gave myself like 6 months before
Um,
I reached out to like I know you're busy, and I know you treat a lot of runners and I know how consuming that can be. And you hate to do that, but like I was out of like I was out like I was tired of substituting around it and trying my own stuff and I knew you would be happy to do it, but it's and help me out. But anyway, yeah, I didn't want to bother you, but you took me on, so thanks.
yeah. And so yeah, 6 months. And what did
Oh,
that
six
frustration
months.
feel like when you couldn't fix this problem on your own, especially also being a PT yourself?
I guess a little scary because I said, well, if I can't fix it, am I going to have to get surgery?
Mm,
So it's kind of scary. And before I went down that pathway and thought about, okay, am I going to have to get surgery or whatever? I wanted to ask somebody I trust and to invest in I guess my long-term health. I just feel like the long-term outcomes, it's just better if I can just handle this less invasively and invest in
yeah.
my health and invest, in the long-term health of my knee. And that's what I did.
Yeah, for sure. 'Kay, a lot of, I'm sure you're familiar with this knee research studies that a lot of people who get knee surgery end up getting a repeat surgery or at least like earlier onset of arthritis and things like that.
Yeah, I mean, I've seen that in my practice, but, look, there's a lot of studies out there, but, once they go in there, um, if you don't take care of it just right, or, there's, you're just introducing another variable of uncertainty with the surgery, and I think there's candidates for it. Um, I just, I don't want to go under an unnecessary procedure. And rather than be out of work, as you know, we're both PTs, I can't work when I'm non-weight bearing and so
Definitely.
you kept me in work,
Gotcha.
you kept me at work and you kept me squatting.
Sounds good. And well, what do you stood up about the method that I used with you? Like, what do you feel like what that I did that was different from like other approaches you may have learned in as a PT yourself or things you've tried in the past?
Uh, I think I think your approach, like movement strategies to find patterns that felt good for my knee and reinforced my knee feeling good that I could do independently made a big difference for me. I tried a lot of conventional strengthening, stretching. I just wasn't getting anywhere with that. And, basically your ability to find a specialized movement pattern that works for my knee and that I could do frequently whenever I had knee pain and eventually calm my knee pain down was helpful. And your belief in not just telling me to like rest it and be out of commission like for however long, keeping me in the game, so to speak, even though I don't formally compete in squatting or anything like that.
Yeah, for sure. Yeah, that's the main thing, finding that good pattern or biomechanical movement pattern that you could do to self-manage this. Because so many
Mhm.
people they come to PT, they want hands-on, like, oh, just work on me, do some voodoo or whatever. But sometimes it's
Yeah.
really finding out the root cause of the pain, and oftentimes like a biomechanical thing or a joint mobility issue that we figure out with a specific exercise, and then you're able to repeat the specific exercise and get this rapid pain relief. Like, and how soon did it like? When did you find the exact moment where you find, hey, this is actually working for me? Like, how quickly did that happen for you, or how did that moment feel for you?
I mean, once you went through your whole evaluation process with me, you found what I needed the same day, and then I could see that it was helpful to, you know, right away, and then over like within a week,
Wow.
it was
Yeah. Like,
yeah, it was obvious the first night, but like it proved you could really see the benefits a week or two in.
that's fantastic. And like, how does that contrast to other methods where you're like, usually you hear from it in PT school, it takes like 3 to 6 months to heal from, conventional PTs, like, oh, 3 months to heal from an injury.
Well, yeah, I mean, if you just look at the studies and things like that, a lot of them have 8 or 12 week follow-ups, and even if you look at conventional strengthening, it can take months to see hypertrophy gains, and it's true you can change your strength quickly through neuromuscular adaptations that you make, especially in untrained individuals. But yeah, generally you get a longer prognosis. Unless you have like a mechanical approach that finds a movement pattern that works for you.
Yeah.
And so I was excited about that. I knew you offered that. So
Yep. Yep. Yeah. Like a symptom modification, get symptoms relief, like pretty rapid symptom relief, essentially. Rapid symptom relief.
well, yeah, I could deep squat, like for example, on our first visit, I would do a deep squat. I had, depending on how much I forced it, like 6 or 7 out of 10 knee pain. Um, we tried in my case, an extension pattern that seemed to help a lot, and I could then deep squat with like 2 or 3 out of 10 pain. So it's like a 50% change in pain inside the session. The
Yeah.
key is being consistent with the specific exercises and force progressions.
For sure, for sure. And what does your training look like now that your knee pain is pretty much improved or resolved?
Running, unlimited, no issue with running. My knee pain is much less in severity and often pain-free, but occasionally it's a little cranky, and then I can hop back on the exercises that I used to be way more consistent with for, you know, the first 2 months of it, and that'll bring it back down almost all the way. And then, but I squat deep. Like I don't worry about whether I'm going to be able to do my squatting workout. Like before wasn't squatting, or I was concerned whether I could do it. Now I don't. I know I'm going to get it done. Like I'm either going to feel great and have no pain and get it done, or if I have to address it with some exercises, I'll get it done. The exercises you showed me specifically.
That's fantastic. Yeah, now you have that confidence that you have the
Yeah.
the tools in your toolkit as to like self-manage this. Fantastic.
Yeah, definitely.
Cool. All right. And what would you say to anyone who's on the fence of potentially like working with me if you had like a patient or a friend or something?
Um, well, I mean, I would if if you've tried a lot of things and it hasn't worked for you, I would definitely give it a try. I mean, I've referred patients to you, I guess, when if I had a stubborn a patient whose case was stubborn and I needed another set of eyes, I mean, I've referred patients to you in the past, for the knees and for the back and other joints too. Yeah,
Awesome.
if you're looking for answers, I was, and Ray helped me.
Awesome. Well, thank you, Mark. This has been very helpful, and your story will help inspire others who may be dealing with pain or struggling with injury, who want to get back to like living an active lifestyle, whether they're running or lifters or hybrid athletes.
I hope so, and I hope this gives people confidence that you don't have to have surgery, and there are clinicians out there that are worth checking out if you have something that's problematic, that you just can't get on your own.
Awesome. Well, thank you, sir.
Of course, man. Thanks for having me on.
I currently have a limited number of private one-to-one coaching spots open for runners and lifters who want to eliminate pain, keep training, and avoid unnecessary surgery. If you're curious, there's a link to apply in the description. Spots are first come, first served. And for this case with Mark, some of the lessons learned. Lesson one, even experienced athletes and physical therapists get stuck when pain is mechanical. Two, you don't need surgery just because something hasn't healed yet. When Three, when you have the right movement strategy, you stay in the game and healing happens faster. If this story resonated with you, you're not broken. You just haven't been shown the right approach yet.